Good morning,
Hi,
Julia.
thanks for joining us. This ongoing strike, the fascinating thing is, I think for the last few, never even make it onto the front pages. People have just got used to the fact that, yeah, sometimes the NHS just doesn't work at all. Operations will be cancelled, people push to the back of the queue, and we just carry on. How long can this go on for?
Well, it's disappointing the government refuses to negotiate. The doctors' demand is clear. You know, they are not worth 30% less in real terms than they were in 2008. The work has become more intense. Doctors are working with less resource, less bed capacity in overstretched environments. And in parallel with failing to resolve the doctor dispute, the government is setting in motion a program of doctor substitution. Now, in the House of Lords today, there will be a motion put forward by Natalie Bennett, former leader of the Green Party, to block an attempt by the government to make non-doctors be regulated by the General Medical Council, further blurring the boundaries and setting up a program of substituting doctors out of the NHS.
Well, I mean, I'm certainly concerned about that. I'd rather have people who've gone through all the rigorous education and training that properly trained doctors have. It's not the answer. Again, this is a government that quite happily, along with the BMA, limited the number of British doctors who could train, put us into this situation in the first place. I just don't know why is it more stressful and difficult now, given that, you know, every time I go into my GP surgery now when I've got an appointment, there's barely anyone there. It's all completely empty. Everything's online. They can do repeat prescriptions online. Everything has been so much more automated. Surely it's easier for doctors now.
No, in fact, what has happened, we might have seen more technology being used, but what has been smashed apart is continuity of care.
But that's up to doctors. No, but that's up to individual doctors' surgeries. If GPs just allow you to see any doctor, you can allow, in my doctor's surgery, you can request any GP specifically. I don't really care who I see. I just need, you know, to get seen. But that's up to individual doctors and individual surgeries to do. That's their choice.
So what the government has done over successive years is to say, unless you work in a particular way, you will not get extra funding. So they use the lever of funding to make GPs work in a way which is actually worse for the patients.
But more and more GPs are working part-time, whether they've got young children or not. They're choosing to do that. That means a lack of continuity of care because they're not going to be available the next time the patient they've seen with a whole gamut of problems comes into the surgery. I mean, look, I think there's plenty you can blame the government for how we've got into this mess. I'm not entirely sure that you can blame the government for GPs not seeing the same patients every time.
Okay, so, you know, the GPs working part-time or averaging above 35 hours a week. So part-time for a GP is full-time for any other person holding down a normal job. The work has become more stressful, more intense because of the fragmentation.
Why?
Because of people languishing on waiting lists.
That's because GPs didn't see anyone during lockdown.
Julia, these are people waiting for hospital treatment.
Yeah.
They have been referred on. They're not waiting to see the GP. They're waiting for hospital treatment. They're waiting for operations. They're waiting for cancer care. And while they're waiting longer, where do they end up needing to go?
GP surgery.
They're ending up using more GP appointments. The GP system is at the point of collapse. We have less GPs than we did 5 years ago. GPs are looking for early retirement, and young GPs are not coming into the job because they see their future as being insecure, unappreciated, under worse financial conditions.
Well, yes, it's not insecure. So they defend the NHS while going to want to work abroad in non-NHS style healthcare systems, interestingly, which is what a lot of us would like to be in. There's loads more to discuss on that, and I know we will another day, but I've just got a couple more minutes. I want to ask you about this story today about Generation Sick Note. Resolution Foundation, a left-wing think tank, has put out stats, and extraordinary, showing young people are increasingly likely to be out of work, jobless, because of mental health problems. You're more likely in your early 20s to be out of work due to claimed health problems in your 20s than in your 40s. This isn't the same in any other country. It's been a huge explosion. Anxiety, stress, depression, alike. What is going wrong? Are these genuine, or do we have a sick note generation?
Well, if you look at what's happened to society, we've had the lockdown, which was detrimental to mental health across the board, particularly young people. You have an economy which is on its knees. You have people going to university coming out with a huge amount of student debt, unable to secure work that helps them have a decent level
There are
of
plenty of jobs.
living standard. And, we have, bad news everywhere, don't we? We have people worrying about what's happening abroad, in Ukraine, in Palestine.
Well, and that's
So
making
there's
our
a lot.
children depressed and anxious. I mean, frankly, you know what? I mean, my parents' generation, grew up, Cold War, for goodness sake. I mean, we're all just supposed to. I can't go to work because of, Ukraine. I mean, that's ridiculous.
Well, you're plucking out one factor. I gave you a whole list of things.
Yeah.
You also have.
Are these people genuine, though? Do you think we genuinely have a mental health crisis among our young people? I completely accept the impacts of lockdown. I think also impact of social media. But do you think we genuinely have, uniquely in the Western world, we have this issue?
Well, if you look at male suicide in America, it's at record levels. We're not far behind in this country. If you look at addiction levels, if you look at the diseases of despair, which include addiction, alcoholism, gambling, depression, all these illnesses are going up, and many of them are a product of our economic system, which doesn't value human beings, which is all profit-driven, advertising-driven, making people feel unsatisfied with their existence.
All right, I'll have to leave it there, Dr. Bob Gill. Thank you very much indeed. Coming up in the next hour, Israel and Hamas were told are close to agreeing a pause in fighting that would see the release of Israeli hostages. Will it happen? We'll talk about all of that coming up very soon here on TalkTV. You're watching Julia Hartley-Brewer on TalkTV. See you in a moment.